So am I suggesting that not all relationship problems can be resolved in couples therapy? Yeah, I am. Not all relationship problems are resolvable in couples counseling. For example, when a drug or alcohol addicted partner is unwilling to accept responsibility for their addiction, couples counseling is not going to be useful. Another problem that can make couples counseling ineffective is domestic violence. However, there are some counselors who have specialized approaches, as is the case with substance abuse, by the way. They have specialized approaches and training to treat intimate partner violence or substance abuse. So be sure to ask your therapist if they're skilled in treating that issue or those issues. Another example of when couples counseling is unlikely to be effective, which I talked about a bit earlier, is when the relationship problems have become so chronic that one or both partners have become contemptuous. And I often think of contempt as sort of the behavioral manifestation of chronic resentment. It's when someone is seen as worthless or inferior or unable to be respected. And that gets communicated through sarcasm on a regular basis, mockery, other displays of disgust. Now, fortunately, contempt, as I said, takes a long time to develop. It tends to happen after no efforts have been made to resolve problems in the relationship, or when efforts have been made and they fail. So the couple remains in this nasty state for a long time. Unfortunately, by the time contempt kicks in, motivation has typically reached an all-time low. And the combination of contempt and low motivation creates a real nasty roadblock to resolving problems. Although a couples therapist should never make a recommendation or suggestion that a relationship should end, they should constantly assess the viability of ongoing counseling, and they really need to be honest with the couple about whether couples therapy is the best option.